Okay, 9 o'clock, we'll go ahead and call the meeting to order. So I have a motion to approve the agenda.
So moved.
Second. Any further discussions? All in favor, say aye.
Aye.
Minutes from last meeting, Betty.
January 22nd, 2024, Chairman Hubble called the regular meeting of the Wright County Board of Supervisors to order at 9 a.m. Members present were Cluse, Rasmussen, and Helgeveld. Motion by Cluse, second by Rasmussen to approve the tentative agenda. Motion carries. Minutes of the regular meeting of January 15, 2024 were read and approved. Approved claims for payment. Bob Ritter spoke in open forum about the post-hearing reply briefs on the Iowa Utility Board's proceedings for the Summit Carbon Solutions Pipeline. Ritter stated that the pumping stations aren't under the permitting process with the IUB. Motion by Rasmussen, seconded by Cluse, to receive the quarterly revenue report from the Wright County Recorder. Motion carries. Peggy Slutenhofer, Wright County Treasurer, presented the semi-annual report. The only concern would be the deposit under the American Rescue Plan Act for the Local Assistance and Tribal Consistency Fund. The LATCF was set up under the ARP fund, but with a separate project code. Slutenhofer will work with the auditor's office to possibly make a new fund for the LATCF and do a transfer to the new fund. Motion by Rasmussen, seconded by Cluse, to receive the semi-annual report from the Wright County Treasurer. Motion carries. Motion by Rasmussen, seconded by Cluse, to approve the payroll adjustment for Jennifer Hogreave and the Recorder's Office from clerk to chief clerk. Motion carries. The payroll adjustment for Amanda Meyer and the auditor's office was tabled to January 29th. Motion by Cluse, seconded by Rasmussen, to appoint Darren Baker under owners of city or town property and Todd Swalen under licensed real estate salesmen or real estate brokers to the Eminent Domain Compensation Commission. Motion carries. Motion by Rasmussen, seconded by Cluse, to appoint Alex Amundson as an Eagle Grove Township trustee. Motion carries. The appointment of Troy Township trustee will be tabled to January 29th. Adam Clemens, Wright County Engineer, gave an update on the secondary roads. There were 21 work orders completed last week, with 14 of them using the snow blower and excavator to move troubled areas. Blades were out last week cleaning up from the winter events. Trucks were out checking hard surfaces. Crews were out Sunday, January 14th, clearing from the weather event. Trucks were out until 5 p.m. Thursday, January 18th, and out at 5 a.m. Friday, January 19th, with blades out at 7 a.m. Dwayne Asby with the Wright County Charitable Foundation met with the board to give an annual update and request funding for the fiscal year 2025. The Wright County Charitable Foundation is requesting $9,000. This will be discussed during budget discussions. Motion by Cluse, seconded by Rasmussen during the meeting. Motion carries.
Any additions or corrections? If not, they will stand approved as read. Claims has been around. Open forum for public. Anybody here? Or I don't think we have any on Zoom.
Yeah, check participants, or just click on that, to the left, to the left, to the left, right there.
Okay. Oh,
Sound like a dance.
yeah. Exactly. Anybody on Zoom would like to address the board?
Yeah, this is Julie Glade.
Hi, Julie.
Good morning. Good morning. I just kind of wanted to go on the record for a few things going on with the Summit Pipeline. The week before last, the emergency management officials from Franklin County invited the public to their safety meeting with Summit, and must not have gotten the memo that it was a secret meeting. It was held in the back room of a coffee shop. They had invited one member of the Franklin County Board of Supervisors, so they would not have a quorum. So Paul and I went, and they told us we had to leave before the meeting started. It was their meeting. They had rented the facility, so they could do what they wanted. So we had to leave. I guess I just want people to know, and I don't know if they've held the meetings in Wright County, this initial meeting with the emergency management people, but they are telling first responders when they are holding these county meetings that after 330 feet from a CO2 release, it's safe. And they're quoting from an outdated emergency response guide book that the first responders used during a hazardous call. That these books, they don't pass on to people that these books are outdated, and they're talking about the fact that this would be a release from a rail car, a tanker truck, or a storage facility, not for a supercritical, highly pressurized pipeline. So they're purposely misleading people. They're wanting to pass this information off as accurate before PHMSA updates their recommendations, which we all know should be in the thousands of feet, depending on the diameter of the pipe. I guess I would like EMS officials in Wright County to ask Summit why, if they're so confident that it's safe at 330 feet, why they're telling the emergency response team that once the pipeline is in place, the public will be told to shelter in place when a rupture occurs. And they are telling first responders to not go in to save anyone. I guess I just want Wright County officials to be aware of what's going on, and these people have no conscience, evidently. So thanks for your time.
Thank you, Julie. I think Dean can comment a little bit on that, Julie.
EMS met with Summit on Tuesday afternoon at 1600 with all of the fire chiefs. There were 3 fire chiefs that were not present. And we looked at the Canary dispersion modeling and the Flow 2D terrain aided dispersion modeling that they use, which is not as extensive as this computational fluid dynamics modeling. But all of what you said was not what they were passing on to our responders. There wasn't any specific talk of when the fire department or the first responders would go in. There was mention of shelter in place because some of their studies refer to that. And they mostly spoke about 40,000 parts per million and the distances associated with that and the time associated with that. But the EMS official and myself and the planning and zoning coordinator and the fire chiefs and the sheriff, with the exception of 3 of the fire chiefs, met with them on Tuesday of last week.
Okay, thank you for that. I don't know. I guess that's been reported from different county meetings too. I guess when we're not there, we can't really say for sure what's going on, but anyway, thank you.
You're welcome.
Thank you, Julie.
Yep.
Okay, item number 6, review and act on payroll adjustment for Amanda Meyer in the auditor's office for a department promotion. We were gone last week, Betty, so we wanted to wait till this week and
Sure.
let you have the floor.
So Amanda Meyer, my office, I've been trying to cross-train, and as she's learning, I'd like to, give her a step up as we go. There's a time that I would like to have all my office staff really cross-trained, but there's a time that I'd like to retire. But with that being said, I feel that the 4% immediately and a 4% at July 1 is what I would like to ask. And then with an open mind that maybe in January of 2025, we look at it again as she continues to learn the software, the programs, the budgeting, the finance side of it.
Okay, would she be like a chief clerk then, or any like deputy or not, or just more or less an adjustment salary right now?
Adjustment of salary,
Okay.
because she's the finance person right now, so.
Okay,
I would make a motion to give an immediate 4% pay raise and then a 4% pay raise at July 1.
Second.
any further discussion? All in favor, say aye. Opposed, motion carries. Item 7, Veteran Affair Quarterly Review.
Haven't seen you in 20 years for this.
There's not much to report, which is awesome.
That was good.
I only did one assistance this last quarter, which is not normal. I don't normally do any. So taxpayer dollars spent for assistance was $652 for partial payment of a funeral. The rest came from federal dollars. And then I just put a report in there from November 1 to current, the claims that have gone through and the extra amount of money. And this has changed since I was in here for my budget review.
Okay.
So that you know. Questions?
I have none.
No, motion to accept the Veterans Affairs Quarterly Report.
Second.
Any further discussion? All in favor, say aye.
Aye,
Opposed? Motion carried.
thank you.
Let's see, item number 8, Troy Township trustee, I'm waiting on a phone call, so we should have it finalized by next week.
Okay, so
We'll table
for
that next week, yep. Review and act on liquor license for Paramount Country Club. Paramount Country Club. Class C retail alcohol license 12-month. We're just pending the dram right now. Do I have
Yeah.
a motion to approve,
Motion to approve.
subject to the dram?
Graham, yes.
Second,
Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion carries.
Can you sign the top right corner, please? And date.
It's the 26th. There we go. Adam, secondary roads report.
Okay. The blades were out last week, still winging back and cleaning up. They also went out because we got some warmer weather and de-picked some of the snowpack areas that we have troubles with people going up hills and whatnot and curves so that they can traverse those areas without being slick. So, trucks went out and spread when we needed them to. They also started restocking the sand salt in the outlying sheds. And then this week, we're gonna haul in 600 tons of sand and mix it with salt and then put an order in of salt. I think we're gonna put probably 200 tons of order in for the salt. So, completed 14 work orders. Blower was still out last week. And then you can see our winter operations were what we did last week, Monday through Friday.
do we haul salt in or somebody, a contractor hauls it in?
We went through the DOT's bid last year. We got the same bidder, Blackstrap out of, I think, South Dakota or something like that. They go get it for us and then bring it to us.
Good.
Yeah. About $80 to $85 a ton.
Okay.
And
They bring it here.
they bring it right here, yeah. So it's normally somewhere between a 7 and 10 day turnaround. We'll call them and they can bring it in. So we normally try to keep at least half of our bin on demand, held. I start getting a little, we need to bring more in when it starts getting down that much.
Yeah. Good,
All right,
thank you.
thank you.
Okay, item 11 is a timed event. Any old business, new business, or update on meetings, gentlemen?
I had Central Iowa Detention Friday. And I also had Udmo on Tuesday evening.
Again, I met with Summit with that group on Tuesday. I hosted the Iowa Drainage District Association meeting here on Wednesday, and then had a Midas meeting by Zoom on Wednesday also. On Thursday, CFR meeting by Zoom. I will be going to the Capitol this afternoon for the Watershed Management Authority Day at the Capitol to meet and try and get some funding for that. And then I'll be attending the planning and zoning meeting on Tuesday evening. And then I'm departing on Wednesday. And I will be gone until the I'll meet you guys down at the ISAC supervisors meeting on the eighth
Okay,
in the morning.
will you be zooming in or are you gonna be on contact?
I will be out of the country. I don't believe I will zoom in.
Okay. Okay, I had DCAT this week, more or less an update meeting. We're just kind of sitting here waiting how realignment happens on what. If we are gonna exist, not exist, and what are we gonna look like? And there really is no answers until that top tier gets figured out to figure out how it trickles down, so.
Right.
We're kind of holding on funding and everything right now until that just all. It's kind of a meeting that really had more questions than there were answers, so that's kind of an update on that. Okay, we will be in recess until 9:30. Okay. Hey, we are back, 9:30. Mickey Shubin from Community Family and Resources, give our annual update. Welcome.
How are you guys? this
Good.
morning?
Good. Thank you.
Watch yourself when you sit down. That piece of wood sometimes takes your knees out.
Okay. Well, we have bring you guys
Thank you.
goodies from state. And then some information. Are you listening? All right. So I'm just gonna go ahead and go over a few of the things that we have at CFR. So some of our grants have kind of rolled over at the state level. So our integrated provider network, that grant, they haven't done the competitive RFP process. They've pushed that back now until 2025. So we will have to write that competitively again then, which means all of our IPN services that we decided upon during the pandemic are the services we have to continue through then, which does not make me entirely happy because the data that we collected during that time, I don't feel was the most accurate. I think it could have been much better. But we have to do what the state says, of course. So, one of our other things that, we have is the tobacco grant. So we have that in 11 counties. So we have our normal service area of Service Area 6, and then we have Cassuth, we have Hardin and Franklin. And those are just for the tobacco. And then we also have the state opioid response grant. And then we also offer the DUI classes in Fort Dodge and Ames. And then we do have 2 new grants that are in Humboldt County and Webster County. That's for preventing alcohol misuse among older adults. So for this area, we have, for the IPN services, we have marijuana for school policy. Trying to strengthen the school policies surrounding marijuana use, because we know that youth are now getting their hands on vapes that contain THC sometimes. So that is something that we'd like to address within the schools. Just because we know that youth that have other issues, may it be, health issues or, other substance issues, might turn to THC, thinking that it's going to help them when it really doesn't. They don't understand all of those things that come with it, the bad side effects. And then we do Generation RX, and I was just talking to our public health person here, and they are doing it in the schools, which I think is amazing. So our Generation RX program is for older adults. So that's going in and doing it with activities, just so that they kind of have a reminder. This is why doctors give us prescriptions. This is why it says, how you're supposed to take your prescriptions on the bottle, that type of thing. And then workplace policy for gambling. I know gambling isn't one of the forefront issues, but it is becoming more of an issue with online gambling and all of that kind of stuff. We've seen the numbers go up consistently since all of that has come about on TV and, you know, DraftKings and all of that kind of stuff. So we're trying to address that as soon as possible. So we're addressing that in all 8 of our counties. So for tobacco services, we can do presentations on My Life, My Quit. So that is basically a teenage version of Quitline. So Quitline is where adults can call in for help with quitting tobacco, nicotine. They now know that there's an issue with youth vaping. So they decided to do on My Life, My Quit. So it's basically, it mirrors the adult. So it's like a nicotine cessation program. They get 5 free sessions with a counselor. They can do it video chat, texting, all of that kind of stuff to make sure that it's up to their technological needs and things like that. And then we also want to do things such as like really building our coalitions within prevention work, because we know that prevention can't happen with just a few people. Like, we need a tribe of prevention people, really, to make sure that, you know, the community readiness is there, to make sure resources are there, all of that kind of stuff. So one of the other things that is not necessarily in the Wright County tobacco goals, but one of the other things that we can do is tobacco-free, nicotine-free policies. And I'm a pretty big advocate for that, just because a lot of places, of course, you have to have smoke-free Air Act. A lot of places don't understand that the Smoke-Free Air Act does not include vapes. If they are vaping, technically, it's not covered under Smoke-Free Air Act. You have to have a tobacco-free, nicotine-free policy to be able to cover that, because that is not smoking technically when you're vaping, because it's nicotine that you're vaping. So that's why we really want a lot of places to go ahead and have that tobacco-free, nicotine-free policy so that it covers everything. I know our youth, they listen to commercials a lot and things like that. One of the most disturbing commercials that I hear all the time is Central Iowa Vapors, that has their little commercial that says, "It's not smoke, it's vapor." Technically, that's true. But it's not like water vapor that doesn't hurt you. It's aerosol vapor, and youth do not understand that. They just hear that and think, oh, well, that's not bad. So then they think that vaping is a better alternative than smoking. So as far as our state opioid response services, we of course can offer free trainings. So I've listed those out, and there is a handout in your packet that has some of those trainings on there as well. By far, our most popular one is the Narcan deployment training, the overdose one. So that one has been very popular throughout the counties. We now can do distribution of the Narcan, means it's over the counter. CFR has gained acceptance from the state to be able to distribute that when we go out. We're coming up with an internal record keeping system for us so that we can report to the state, like how many we give out and all of that kind of stuff. We have to have like the sectors and stuff that we give out to. So we have to come up with that before we can actually hand it out. But we're having a meeting about that like next week. So now, instead of giving everyone a certificate that you have to take to a pharmacy where you can then have it run through your insurance and it ends up being free, but then that's just another step. if they come to the class, they stay for the whole class, I can just say, here you go, thank you very much for coming to the class and learning how to distribute this. So that is like amazing. I'm so happy for that because there has been so many times that I have done classes and then 5 months down the road, somebody will see me and, hey, I lost my certificate. Or I never did get to the pharmacy before it expired because we have to go on the grant cycle, expiration dates to make it fit for funding, you know? So then I have to redo a certificate and all of that kind of stuff. So this will make it much simpler. That way I can just, you know, hand it to them and they're all ready. And like I said, we teach our DUI classes in Fort Dodge and Ames. So for our county funding for FY 24, of course, we support prevention efforts and trainings. It kind of supports the services that fall outside of the grants that we already have. Because we know that at the state level, they are getting much more restrictive kind of on what they want us to provide. They have said, you can't be everything to everyone. Well, I don't like that statement. I want to be able to provide the services that the county wants and needs. So we did attend the cultural festival with resources. We attended the Slam the Stigma event in Eagle Grove that was just like last week, the 23rd. And then we're going to be attending the February 2nd one at Clarion Goldfield Dows. I would say that I am very, very proud of you guys in Wright County for bringing that. I was at the very first Slam the Stigma event. And myself and Regina Subir from Community Health Center had tables sitting right side by side, and we thought that it was a fabulously attended event. We took it to coalitions that we attend, and now it is in several different counties. So I know Fort Dodge has it. Calhoun is going to be doing theirs for the first time, I believe tomorrow. Let's see here, they're gonna do one at Iowa Central. Hamilton County is doing them. So, yeah, so you guys started something really big. I think that that's amazing. Because we do know that mental health among young people especially is a rising problem. I mean, it's always been an issue, but I think the more kids are, for one, online, the more kids use substances, using them earlier in their life is more troublesome. All of those combination of factors are deteriorating our kids' mental health. So whatever we can do to assist with making sure that they know that there's resources out there, there are people that want to listen, there are people that want to help. I mean, I'm all for that. I have kids of my own, so this is one of the big things for me that you can tell on my mug, I've got lots of different little inspirational type things. So I'm pretty passionate about that. So of course, we are requesting the 7,200 for FY 25. That of course is going to support those services that fall outside of our other grants. And then we also have our treatment services here in Clarion. That's on First Avenue Northwest. And we have a counselor here on Wednesdays and Fridays. For our residential treatment and withdrawal management in Fort Dodge, we do have 12 beds for men, 10 for women, and 2 available for gender neutral. We have 13 withdrawal management beds, and then we have 16 adolescent STARS beds. So that's for any adolescent that needs help with a substance use disorder. They stay on site, they have a classroom, that way they don't fall behind in their studies, because then that would just be another stressor when they come out. We do have recovery housing. We also have medication assisted treatment services at our Fort Dodge and Ames locations. Oh, I keep forgetting about Iowa City. We did merge, Prelude merged under us, in Iowa City area, so they have some of these same services. Sorry, I keep forgetting about them because they're so far away. So we do have mental health services in those locations as well. In FY 23, for Wright County, 2% of our substance use disorder treatment came from Wright County. So that's 82 of the 4,058 persons. And then for mental health, it was 2%, and that's 18 out of the 872 persons served. So in your packets, it talks a little bit about, got a list. This is from our director's report. So this is just that, all of the services that we offer, and this includes like the Iowa City area as well. So some of these we do not have around in this area. Like the sobering services, we don't have that here, but that's down in the Iowa City area. Some of them that have like drug courts for Webster County, we have that in Webster County. So they've tried to kind of put county names if there's specific ones. Then there's the service area map that has some of our different locations. It's got the persons served. And then county of residence. It's got the demographics. And then the last page is primary substance abuse. So I kind of wanted to just quickly go over that. Alcohol, of course, is the #1 substance abuse at 45%. Then it comes to methamphetamines at 27%, and then marijuana at 19%. So those are the top three. I believe those have been the top three since I've worked at Community and Family Resources. I've been here almost 11 years. So that hasn't really changed. I think some of the numbers have changed just a little bit, but not terribly. And then I also, but just because we have gotten some of the money for preventing alcohol misuse among older adults, I did include this little poster that talks a little bit about craft beers. Beers have gotten very popular. A lot of people don't know that craft beers, if you have one of those, that's actually equivalent to 2 domestic beers. So if you had like a Bud Light, the amount of alcohol in a craft beer is equal to 2 Bud Lights. A lot of people don't know that. I haven't had one today.
Yeah, I didn't know that.
Yeah, some of them are pretty close.
Oh,
Yes.
I can't walk.
And some of them are even more so
Right.
than 2 beers. But most of them are at least
Two, yeah.
2 beers. So do you guys have any questions for me?
I don't, thank you for the.
We appreciate what you do.
Thank you. I would like to do more. Just let us know. We do have a person, that's what I was telling your public health person here, we do have a person that lives in Clarion that is going to be serving the Clarion area, the Wright County area.
Right.
So he just started in December, so I'm kind of finishing up his training, and then he's gonna come and provide all kinds of services.
Excellent.
Join the opioid.
Yes,
Opioid reduction
Absolutely.
task force.
That'd be great.
yes, yes.
Okay, well, thank you. We will take that. We're doing our budgets now, so we'll take that under advisement.
Thank you.
Thank you.
Thank you.
Okay. I think we'll have a work session at the engineer's office on budgeting. After this, if not, I'll take a motion to adjourn right now.
So moved.
Second.
Any further discussion? All in favor, say aye.
Bye.
Aye. We are adjourned.